Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 569 of our pharmacotherapy series, which majors in sleep disorders. The first case reads, GBS, a 23-year-old man with narcolepsy, has been taking mixed amphetamine salts extended release 60 mg in the morning for sleep attacks associated with narcolepsy, and fluoxetine 20 mg daily will be started to treat cataplexy. So my first question to you reads, what are the potential risks of using both mixed amphetamine salts and fluoxetine to treat GBS? Anorexia, gastrointestinal complaints, manifesting as abdominal pain, nausea, vomiting, and diarrhea, anxiety, irritability, insomnia, and headaches are common side effects of stimulant drugs. Though rare, psychotic reactions can occur in narcoleptic patients taking stimulants at any dose. However, psychosis generally resolves when the stimulant is discontinued. Stimulants, even at high dosages, e.g., 80 mg methylphenidate, usually do not bring a patient to a normal level of alertness, and sometimes nocturnal sleep is disrupted. To prevent stimulant-induced insomnia, doses should be taken before 3 p.m. Tolerance to the therapeutic effects of stimulants may, however, develop in some patients with narcolepsy. Drug holidays may allow the patient to recapture therapeutic benefit. However, many patients opt for an increased stimulant dose instead. Exceeding maximal recommended doses of stimulant significantly increases the risk of psychosis, substance abuse, psychiatric hospitalization, tachyarrhythmia, and anorexia, according to a case control study in 116 patients with narcolepsy taking stimulants. Seizures have also been reported. Fluoxetine may improve cataplexy, but it can worsen nocturnal insomnia and contribute to restlessness, headache, nausea, and sexual side effects including anorgasmia. In addition, fluoxetine is a potent CYP2D6 inhibitor resulting in higher levels of amphetamine. GBS should be monitored closely during the initiation of fluoxetine therapy, and the amphetamine dose should be lowered by 30% to 60% to minimize side effects and prevent toxicity. The optimal therapeutic dose of fluoxetine to manage cataplexy has not been established, but low doses may be effective and minimize the risk of side effects. GBS experiences intolerable nervousness, irritability, and nocturnal insomnia on mixed amphetamine salts and fluoxetine. There is no improvement in cataplexy with the addition of fluoxetine. He asks about switching to modafinil and sodium oxybate. Does the combination of modafinil and sodium oxybate offer any advantage for GBS? Modafinil's efficacy relative to other CNS stimulants has not been adequately assessed in controlled clinical trials. However, it has less potential for insomnia and adverse CNS reactions at recommended dosages between 200 and 400 mg per day administered in the morning. It also has less abuse potential compared with stimulants and is a Schedule IV controlled substance. Headache was the only adverse experience rated significantly higher than placebo in 283 patients taking the recommended dose of either 200 or 400 mg per day of modafinil. Anorexia, nervousness, restlessness, and pulse and blood pressure increases are dose-related side effects to discuss during counseling. The maximal tolerable single daily dose may be 600 mg per day, because 800 mg per day produced increased blood pressure and pulse in one tolerability study. Gradual dosage titration improves tolerability. Armodafinil, an active stereoisomer of modafinil, is effective at usual doses between 150 and 250 mg per day. It has a similar adverse effect profile as modafinil. Improved daytime wakefulness is an advantage of sodium oxybate compared with antidepressants. A controlled trial involving 278 patients showed an increase in slow-wave sleep, that is stages 3 and 4, and decreased nightly sleep disruption in patients taking sodium oxybate with modafinil compared with modafinil alone. Sodium oxybate can be administered safely with stimulants and modafinil. However, co-administration with other CNS depressants, including hypnotic medication, is contraindicated because of the risk of respiratory depression. The next question reads, what counseling should GBS receive as he switches to modafinil and sodium oxybate? People taking modafinil should receive counseling regarding the potential for drug interactions. Modafinil induces CYP3A4 metabolism primarily in the gut and inhibits CYP2C19. Decreased levels of triazolam and ethinyl estradiol have been associated with modafinil co-administration. Enzyme inhibition may also occur. Modafinil's inhibition of CYP2C19 is the proposed mechanism behind modafinil-associated clozapine toxicity. Monitoring for drug interactions is crucial because modafinil and armodafinil are increasingly used for other indications, including daytime sleepiness associated with Parkinson's disease, shift work, fibromyalgia, sleep apnea, fatigue associated with multiple sclerosis, and attention deficit hyperactivity disorder. Sodium oxybate should not be given to those with sleep-disordered breathing, sleep apnea, or an alcohol or substance abuse disorder. Adverse effects include nausea, headache, dizziness, and enuresis. Safe co-administration of modafinil and sodium oxybate has been described in clinical trials. However, cases of severe side effects including panic, psychosis, depression, and new-onset suicidal ideation have been described. The risk of serious side effects versus benefits in managing cataplexy and nocturnal insomnia should be discussed with GBS and his family. Close monitoring, particularly during the first weeks and months of treatment and when dosages are adjusted up or down, should be advised. GBS should be instructed how to properly administer sodium oxybate, drinking half the dose on an empty stomach immediately before bedtime and then setting his alarm for 4 hours later to take the mid-nocturnal dose. The benefits, possible risks, and importance of regular physician assessment have been explained to GBS, and he agrees to report efficacy and adverse effects to his primary care provider regularly. GBS is reminded to take the medicine at regular intervals along with daytime naps. Why are naps helpful in the treatment of GBS, and what other behavioral interventions are useful in treating narcolepsy? Strategically timed 15 to 20-minute naps taken at lunch and then again at 5:30 p.m. can be refreshing for patients with narcolepsy and increase their time between sleep attacks. Narcolepsy support groups are available and may help GBS better cope with such a life-changing chronic illness. It also is important for GBS to avoid alcohol and to regulate his bedtime and wake-up time in the attempt to normalize his sleep habits. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 570.